Welcome. I'm Elizabeth D'Orazio coming to you from New London Hospital, and I'm joined by Tom Manion, the CEO here, and we're going to learn about what brought him to New London Hospital and his incredible professional background. Thank you for joining us, Tom.
Thank you.
So, Tom, you've had quite a journey in medicine to bring us to this point where you're helping our community. Tell us a little bit about where you got started.
Sure. So I started my career at Memorial Sloan Kettering Cancer Center in New York City. My first job was as a research study assistant, so I would actually go into rooms with patients and enroll them into clinical trials. I did that for a few years. I loved working in research, but eventually I started getting pulled more toward the leadership side of the coin, less the front end user or person interacting with patients. And so I moved into some leadership roles in clinical trials, and eventually actually moved into some financial and operations roles at Sloan Kettering. I got my master's in health policy and management with a focus in financial management at NYU. And I got married all while down in New York City. Around that time, I realized I needed to, we wanted to continue to grow our family, and trying to buy a one-bedroom apartment in New York City is not really a feasible thing for someone earlier in their career. So we moved upstate to upstate New York, where my parents were from. And I started working, running the cancer centers at Bassett Medical Center.
Sure.
From there, I moved on to director level roles, running their orthopedic and musculoskeletal groups, running some population health programs for them in this program called DISRIP. And most recently, I was the vice president of the medical group for Part1 Medical Center in Vermont, part of the UVM Health Network. As running, we had about 12 practices, 40 providers, and since then I have come here. I started here in March, and it's been an interesting start ever since I landed.
I say you got kind of thrown into the fire, but something interesting about your background is, unlike many people who get involved in hospital administrations, you actually started working one-on-one with patients.
Right.
Now, do you feel that gives you sort of an edge and a unique perspective when dealing with the administrative side here?
Absolutely. I mean, I think it's wonderful to have that experience, to actually know what it's like to sit with a patient, talk with them, to hear where they are. I don't think it necessarily compares to a nurse or a physician or anyone else who has that true hands-on healing, capacity. But it really, instead of doing something over the phone or with a plexiglass between us, actually going in and sitting and talking with the patient about a clinical trial definitely helped give me an appreciation for what they're going through. In that case, they were all cancer patients, people who were diagnosed with cancer in various stages. So it certainly grounded me. It was part of the reason why I went into that role at first, having family members who have had cancer. I think most of us can say that we've have been there, where we know someone who's been afflicted. And personally, I didn't know really what I wanted to do. I was a biology major in college. I was pulled toward healthcare, but I wasn't quite sure if I wanted to be in a clinical role or in some other kind of role. So it was a great place for me to start, and I found my path, and here I am.
I just want to ask you about sort of the logistics, going from New York City and NYU and then coming to, New London. Very different dynamic, but you did have that stop in Vermont, which is nice. We call it the stop waves. People get to New Hampshire. It's kind of like your first bus stop before you get to the perfect state. Tell us a little bit about how coming to the New London community, which is so tight-knit, has, been affecting you.
Yeah, so I wish that I could be more ingrained in it right now with, the first few months having most things shut down, right? A lot of people doing the right thing, socially distancing. I think there were some meet and greets that I had set up with many community members that were canceled.
Right.
A lot of things we transitioned to virtual meetings, and so I've actually been calling a lot of people in the community or doing a WebEx or something like that on the computer to meet them. And just recently, I've started to get to know people in outdoor socially distant spaces, which is nice. So it's been wonderful. Right now, I think my wife and 3 kids. I have a newborn that was born last week. Are at the Elkins Beach right now, enjoying just being outside. So it's been a really great start for us. I'm looking forward to getting to know more people. I'm looking forward to when we can all take our masks off. Well, we have ours off because we're far enough apart, but to actually go outside and sit down in a restaurant and get to know people and look at them in their whole face, not just from here up. Yeah.
Well, I want to thank Tom Manion for joining us, the CEO of New London Hospital, and hopefully with this series of interviews, you'll be able to get to know him better as he helps influence our community at this wonderful place of healing.
Thanks, Tom and Elizabeth. Next week, we'll hear more about his professional background and family. Up next, we'll meet Keith Coughlin, the Executive Artistic Director of the New London Barn Playhouse, looking forward to their future. Remember, buying local helps sustain the strength of our communities. Now, a few words from the good folks that keep Yankee Chronicle coming to you.